Welcome to the new episode of Policy Beyond Politics, the show that discusses the various contemporary issues and global order. This time we are going to discuss COVID-19, the novel coronavirus, and how this virus has spread in India in the last 60 days. We know that there has been a lock. There are different phases of lockdown in the last 2 months, and CPPR has been working on various COVID-related topics ever since COVID was reported in India. We've been writing articles. We've been discussing various policy issues related to COVID, and also very importantly, we've been discussing the spread of corona every day. The infographics is there on our website, and this is done by our senior fellow, Dr. Rijwan John. So today I'm joined by Dr. Rijwan John to discuss the trends and projections of COVID-19 in India, and also what we could expect in the next few months. Welcome to show, Dr. Rijwan John.
Thank you, Danu. Thank you for the introduction.
Thank you. So, my first question is: you've been, analyzing this trend for the last 2 months, and what is your projection now about COVID situation in India?
Well, predicting what's going to happen is anyone's guess. But yeah, um, well,
Do you see any trend as such evolving in India?
yes. I mean, I've been observing it very closely, almost on a daily basis. And as you all know, I mean, we are currently at about 2.1 lakh cases, and about 1 lakh of those cases have already been recovered. So, which means we are at a recovery rate of around 48.4% as of yesterday. Um, but at a national level, we really do not see any sign of this being flattened or anything as yet. So in fact, we are seeing still an exponential growth of about 4.6% on average every single day for the last couple of weeks. Now we've been having a growth rate of total cases in the range of about 5.5 to 4.5% range, which has been quite consistent. So the graph keeps going up that way, and also because and what is also important to note is that almost 66% of the total cases recorded in India right now are coming from four large states, which are essentially Maharashtra, Tamil Nadu, Delhi, and Gujarat. So the Indian graphs pretty much reflects what is happening in these states in particular. So yeah, I mean, in terms of prediction, at the moment we are seeing something like 8,000 to 9,000 cases per day of the last couple of days, and my understanding is that at this growth rate, if we were to continue the same growth rate as existing now, we will be seeing 10,000 plus numbers daily basis per day.
Daily.
In the next couple of days, even within a couple of days, we'll be seeing those numbers, 10,000 plus per day. And if my calculation is right, I would say in another 15 days' time, we should be looking at 15 or second half of June, at least we'll be looking at 15,000 cases per day. That's my assessment as of now.
You mentioned, most of the cases are coming from, 4 or 5 state cases. Whether this old trend that we have seen at the national level, only if we could contain this spread in all these in all these 4 states, then only we would be able to reach to a situation where a flattening of the curve starts.
Well, that's I mean to an extent right, but unfortunately, with the new relaxation in lockdown, we are actually seeing movement of people across the state borders quite heavily happening now, especially now since the unlock one, as they call it now. What is supposed to have been the lockdown 5 is now is called unlock 1, indicating that the government is is, in phases they are trying to open up. So
Right.
as this happens, we experience more people moving out of the states and to each state, etc.
Mhm.
So, I mean, my assessment is that even if some of these large states are able to contain, which itself is in doubt at the moment, we would be experiencing.
So you're not in your analysis, you have not seen any, any containment as such for the states like Maharashtra, Gujarat, in the last few weeks. I mean, is the
Uh,
number is growing or number is decreasing there?
in Maharashtra, for example, the numbers have declined over the last few days. But
Mhm.
one of the reason is also that they have reduced the number of testing.
Mhm.
So one cannot be very sure whether these numbers, the reduced numbers that you're actually witnessing now, is
Mhm.
because the cases have actually decreased or is because you have reduced the number of
Okay.
testing,
Okay.
right? So there's
So how many
clearly,
states in India reduce the number of tests now?
well, I mean, many states are increasing the test, but the problem here is that, we are not increasing the test at the same rate as the cases are being identified. In other
Okay.
words,
Mhm.
the pandemic is actually going ahead of you.
Mhm.
So unless
Okay.
I mean, there are certain statistics that one can clearly depend on to
Mhm.
see whether a particular state is being able to contain the spread or not.
Mhm.
One important thing is to see how the percentage of tests turning positive. What is
Mhm.
the trend in that? I mean,
Mhm.
are we seeing a higher and higher percentage of tests turning positive as we go along? If
Mhm.
so, meaning if that is the case, we are
Mhm.
not being able to contain the situation. That is the
Right.
meaning of it.
Right.
So ideally, to be able to say that we are able to contain the situation, we should see the percentage of tests turning positive should systematically decline over time.
Okay.
But that is not the case in Maharashtra, that is not the case in Gujarat, that's not the case in Delhi. In fact, in all these states, even including Tamil Nadu, in
Mhm.
all the four high burden states at the moment, you see
Mhm.
a high percentage of tests are turning positive, and the rate at which it is turning positive is also increasing. Meaning,
Mhm.
if you when I looked at the last 2 weeks data, it's
Mhm.
clearly it's very clear to me that the percentage of tests turning positive is actually increasing in all these four states, and it is particularly so in Maharashtra and Delhi.
Okay.
So
Okay.
I mean, if I use that metric, I have no reason to believe that these states have actually contained it yet.
Okay.
And to substantiate another part of your question, even if let's say these states are able to contain, that doesn't mean we are able to contain because of the movement across the border. You see that new cases are now the number of daily cases have now increased very much in some
Mm.
of the other states like West Bengal, Haryana, Karnataka, etc. In the past few days, or even the northeast part of India. Many of the northeastern states are now seeing more and more
Mm.
cases as we speak. So although they
Mm.
are very small in numbers at the moment,
Mm.
those numbers add up to the national
Mm.
total, and that is the reason why we are still not experiencing a sort of a slowdown at the national level at the moment.
So while we discussing this COVID case, many argue that the mortality rate or the fatality rate is less compared to many other diseases or illness. So how
Uh-huh.
do you look at this numbers? Because your number, the cases reporting is very high. It is
Uh-huh.
growing by every day, and also
Correct.
the number of recovered cases also growing. I mean, that's what the Ministry of Health is saying. But your death rate is almost like stable, or is it increasing now?
Well, I mean, one metric that is looked up is case fatality rate. I mean, that is
Mm-hmm.
basically the number of deaths due to COVID
Mm-hmm.
as a fraction of the number of identified positive cases in a time frame. Like, let's say from the beginning of the COVID up till now, how
Mm-hmm.
many deaths have happened and how many cases have been identified. And
Mm-hmm.
that percentage is right now at around 2.8 percentage. So
Right.
meaning about 2.8% of the positive cases have died. Okay,
Mm-hmm.
and
Mm-hmm.
it used to be more than 3% in the beginning. I mean,
Right.
we have been systematically, I mean, consistently decreasing that number, and that's bound to happen because in many cases, but many epidemiologists are of opinion that the case fatality rate should be below 1% ideally.
Okay.
But because the denominator of this case fatality rate is the total number of identified cases, and that again depends on how much test you are doing. The more cases that you identify, you would typically see a less mortality rate, I mean, CFR, as we go along. But then we need to also place this in the context of other mortality out there. India's typically in India, our true death rate in India is in a year is about 7.3 deaths per thousand people in India in a year. Okay, so that translates to something like say 10 million, approximately 10 million deaths in a year from all kind of diseases and accidents and everything. So, which translates to say, if I were to convert it into a daily term, that would be around 27,000 deaths every single day. Now compare that with the COVID deaths that is happening right now between say 200 to 250 at the moment. But of course, I don't want to trivialize it by saying this like this, because then when you compare it like this, it becomes completely trivialized, right? So that should not happen either. The thing is that maybe it is not enough to look at only these reported COVID deaths, which are reported to be attributable to COVID. But there are also many other kind of deaths that are happening because COVID is there. See, for example, migrants dying on the road.
Right.
They are moving because COVID is there, right? And so is the case of many other deaths. And maybe there are many other diseases for which people are not able to get adequate treatment because hospitals are already jammed with the COVID patients. So it will also be increasing the mortality of many other reasons.
So you're saying, you're saying, sorry to interrupt you. I mean, you're saying due to COVID there are deaths, and there are also indirect, deaths because of COVID. Migrants are suffering from this.
You want to call it indirect or direct? That's a question of debate. So ideally what economists or epidemiologists in many countries have done is to look at what is called excess mortality. Usually in every country they have a concept of what is an average expected number of deaths during a given time frame. Like for example, every year in April or May, how many people are typically dead in India, for example. And then you look at that number over the last few years and compare that with the total number of deaths happening in this year. Okay, so the difference can be attributable to COVID. So that is sort of an excess mortality that we are calculating.
Yes. So that excess mortality is very high now.
No, we don't know it because in India we really don't have daily or monthly reports of deaths from other diseases, so we have no way of calculating it actually. But many other countries have published the excess mortality rate. I mean, many organizations have published it, but in India we are not able to do it because of lack of adequate data to calculate.
That is my next question. I mean, this situation also teaches quite a lot of lessons in public policy and public health related aspects. So this is also one new aspect that I'm hearing. We don't have that reporting. We don't have the data that is published regularly so that we could able to compare it. So what could the situation what is the lesson we are learning from this? I mean, what could be the, because now for the migrants, for example, many state governments have taken measures to record the data. So here in this case, mortality rates are there, but it is not comparable data. That's what my understanding now. So what is a way probably, the state administration or the union government, I mean, now, think about future in the event of future epidemics like this, the deaths and related suffering, how do we record it? What could be the platforms? What could be the policy changes that we can bring in here?
Well, I think we need to have a very comprehensive method of surveillance and reporting of every diseases and deaths that is happening in the country on a daily basis, and that happens in many countries, you know. So, but whereas we have, for example, our sample registration system, they publish us this annual report which talks about the annual deaths in the country on account of various diseases and causes, right? But we need such we need such reports more frequently, not annually. We need them at least on a monthly basis, so that when these kind of things happen, we can truly actually estimate the true impact of these kind of pandemics on the mortality, etc. But in the absence of that, we can only go by the reported COVID positive numbers. See, the problem is that there are many deaths which are also happening due to comorbidities, and there are instances where such deaths related to comorbidities are not being treated as COVID deaths. Okay, so unless we are able to look at the actual excess mortality, we really can't truly estimate the true fatality of COVID. So the reporting
My last question
is what should be improved upon.
Yeah, sure. My last question is about, you've been analyzing the data for the last 2 months, and how easier and difficult for you in the beginning, or even when you do it today, in terms of data gathering, data collection. Some state governments are doing better job. Some governments are still in a very elementary stage, what I could understand from various platforms. So what is your learning? Like when you compare with the global standards and Indian standards, what are the ways we could improve from here in terms of data collection, data analysis in public health?
Yeah, the data reporting is a major challenge here in India, even for COVID. For example, when you compare the COVID dashboard that is maintained by Government of Kerala, that's an example to emulate for other states in India. The kind of detailed information that the COVID dashboard in Kerala provides is such a rich data repository for anybody wanting to do an analysis, right? But similar dashboards do exist in few other states, like Karnataka, for example, or Odisha, but none of them as comprehensive as the one in Kerala. And many state governments don't even have such dashboards. Okay, and also many state governments also do not report regularly how many number of tests they performed each day, and what is the for example, right now most of the governments are restricted to reporting only number of tests and number of confirmed cases and number of recovered and number of deaths. There ends the story. Okay, but unless we know, for example, on a daily basis, how many are being quarantined, how many are in critical condition, or what is the rate of spread, for example, one patient is spreading the disease to how many others. Unless we know all these kind of statistics, it becomes really difficult to assess the situation and what is going to happen in future. See, the state of Telangana, for example, they have not been even publishing the testing statistics for quite some time. So we don't even know what is the situation with regard to pandemic. We only know the numbers coming up, but then we don't know what is the percentage of the test turning positive in that state, for example. So we have no way of assessing whether the state is actually being able to contain it or not. As an outsider, we cannot say it. So these are the kind of problems. So I think, of course, the state is health is a state subject in India. It's largely within the state government's discretion as to what kind of data should be given out, etc. But of course, I still believe, our central government bodies like, Ministry of Health or ICMR could, give proper guidelines for each state to follow, at least in terms of reporting. What are the standards, or what are the variables to be reported on a daily basis, and what is the time at which it should be reported. For example, now Delhi, for example, it reports its cases previous day. Numbers are all being released the next day by noon or so. So there's a uniformity problem. So we don't know whether these numbers. As an analyst, I face a problem whether when I look at the numbers today morning, I don't have the Delhi numbers, or the Delhi numbers I have from yesterday are actually belong to the previous day. You see, these kind of problems we face.
Right.
So unless there is there needs to be some kind of a standardization, which every state, I mean, we are all in the same time zone. That makes it easy for India actually, for every state to present or release their daily numbers at the same time and on in a standard format. For every state should follow one standard format prescribed by, let's say, Ministry of Health or ICMR, and follow such guidelines. So it makes it easier for even public health scientists and other data analysts to look at these numbers and bring out meaningful conclusions from such data.
Thank you so much, Dr. Rija John. It was very insightful, and I'm sure we'll fight Corona with more data and more analysis in the coming days. Thank you so much for your time, and we are coming to the end of this show, and we will get back to you with more and more different and interesting topics in the coming days. Thank you so much for watching. Thank you.
Thank you, Danu. Thank you.
If you like this show, please share your feedback and also follow the hashtag Policy Beyond Politics. We will be coming back to you with new topics and different insights on various contemporary issues. Please follow us, and thank you so much for your time.